Well, thank you everyone for joining our live with two of Milwaukee's leading wellness women. We are here with nurse practitioner and founder of VIVA Wellness, Jennifer Hruz, and our Lakeside natural medicine naturopathic doctor, Katarina Meister. Did I say it right?
Katarina Meister.
Okay,
Sorry.
so close. I know I just asked you too.
It's all good.
So a lot of people over the last 2 years have been really looking for a different way of approaching their wellness. And so Western medicine and holistic medicine really has become an integrative part for a lot of people's medicine and how they're approaching it. So today we are going to be talking with both Lakeside and VIVA Wellness about how they prioritize integrative medicine and how they are helping their clients reach their wellness goals. Both of them strongly believe in collaborative medicine, and so we're going to talk a little bit about that today. If you guys have any questions during the live, go ahead and just put them in the chat. We have our fun little moderator behind the scenes who will then give them to me at the end of our chat. So let's get started. I would love to start with asking Jennifer, what got you into practicing medicine and what led you to open up VIVA Wellness?
Yeah, so my name is Jennifer Hruz, and I'm a family nurse practitioner, and I got my start, based on a very personal journey. I actually used to be about 100 pounds heavier. I was almost 250 pounds, I grew up overweight my entire life, and I got to a certain point in my early 20s where I just realized that I want something different. I want something better. So I decided to radically change my life, and I started a whole food natural diet. And, it did take me about 3 years, but I lost about 100 pounds, and I've kept it off for 15 years now. So that really was the catalyst for me to, pursue college, become a registered nurse, and then later become a nurse practitioner. And then I always knew that I want to help people on a very deep level become the best and healthiest version of themselves. And so thus I began VIVA Wellness in 2017, and we started out as a medical weight loss practice. And then, I was a solo practitioner. And then in 2021, I decided to take this big leap, and then we added other services that really support and optimize the physical functioning of the body, like colonics, lymphatic drainage, IV vitamin therapy. But for me, it was a very, very personal mission. So that's why I got started in everything.
Which you can totally see every day when you see your clients. Truly anyone coming into VIVA with any type of weight loss goal, everyone is welcome. Doesn't matter whether that's 5 pounds, a lot more than that. Yes. Every single person, whatever their goal is going to be met with that, met with a lot of care and compassion, which is one of the greatest things about VIVA. But Dr. Meister, can you tell us a little bit about naturopathic medicine and what brought you into it and how you entered into doing that?
Yeah, so similar to Jennifer's story, I had my own health journey with acne, and at a very young age, I was placed on Accutane. And for those who don't know, that's a very serious drug to be on at a very young age with lots of side effects. And that experience taught me the benefits and the disadvantages of conventional medicine, that dietary approaches weren't taught to me first, and the emphasis on diet and the connection between your gut and your skin wasn't really talked about. So after getting off of Accutane, I had a bunch of gastrointestinal symptoms, and I decided to take my health into my own hands and search natural doctor, and I came across a naturopathic doctor in my area who actually changed my life. So the first visit, it was a long visit. She took my whole health history, and within 3 months my energy was better, my skin was clear, and I also found out that I'm sensitive to dairy. So all of these different factors led into my acne, and since then I've been able to keep my clear skin, but also realize my triggers to my skin as well. But that led me down to the naturopathic medicine route. So in college, I was actually pre-med at the time. And so I kind of wanted to stay on that same path. And that's why I really valued naturopathic medicine, because they have very similar training as medical doctors, conventional doctors, similar hours of training. But the further emphasis is on nutrition and natural therapies, like botanical medicine, supplements, hydrotherapy, physical medicine, and then, there's also other benefits as well. We emphasize lifestyle counseling. So that's kind of the difference in the education, but it's, you know, very similar. We work really well with like other practitioners in the conventional model.
Yeah, absolutely. Because you've even sent people from your practice over to come see me, I'm a colon hydrotherapist.
Yeah.
And like, it's so cool being able to like have that, like, I can't help you exactly perfectly here, but there's somewhere that we can send you to that's going to basically help sustain that. And I've sent a couple people your way as well. So let's say one of the main issues that one of your clients is coming to see you is struggling with gut health. They're only pooping like 2 times a week. They're starting to break out around their mouth. They're having sugar cravings. What kind of approach would you use?
Yeah, so with naturopathic medicine, philosophy is huge. So determinants of health, making sure you're having a regular bowel movement is part of that. So achieving optimal health, you have to have a bowel movement every day. So right off the bat, this person isn't having adequate detoxification of their organs, so they're having kind of a backup of toxins, essentially. So the first thing that I thought of was the gut. We have to look at the gut, what's going on there. Obviously, it sounds like could be candida, only because I just know what the symptoms are. But we'd want to first rule that out with like a stool test or some other kind of test to rule it out. It also could be SIBO, you know, even thyroid disorders can cause constipation. So we want to get to the root cause of the constipation first. Then the way that we treat gut issues here is I like to use the 4R approach. So remove, replace, reinoculate, and repair. So we first want to remove all of the triggers that cause the dysbiosis. So lots of sugar, refined carbohydrates, that's going to feed yeast in the diet. So we want to remove those first and replace that with whole foods. So here at Lakeside, we're huge as food as medicine whenever possible. So, you know, getting in your vegetables, your fruits, all of those good things, and then removing the processed foods. And then to reinoculate using, you know, beneficial yeast for that problem. Other types of probiotics may be indicated. And then repairing with some other nutrients to help repair that gut lining. So like L-glutamine, bone broth, other types of foods like that.
Big fan of bone broth.
Yeah.
When would you be recommending colonics to clients?
Yeah, so colonics I love to use in, you know, motility disorders, number 1, especially if you're not having regular bowel movement. You need to get that waste out of the body because usually colonics are indicated when there is lots of toxic waste built up and you're not removing that effectively. So that can cause all kinds of havoc, whether it's your gut health, your mood, your energy. All of those things are related to your gut health. And when we improve the gut, I'm a firm believer that like all disease starts in the gut. So when we remove that, we can actually heal the gut and heal those other symptoms that that person is having. So colonics could be indicated in any of those situations, but usually the first is like my go-to is like motility, and then if there's other issues at hand, colonics can always be helpful. That's why I always love to give that to my patients because I want them to have the tools to get better.
Totally. What made you want to bring colonics into your space, into VIVA?
Yeah, so again, this is another like really personal story, but and again, I'm a family nurse practitioner, so we didn't learn any of this in NP school. But in 2019, I actually had a cerebellar stroke, and so I actually had a small hole in my heart, and so it was a congenital anomaly, and you know, a tiny clot snuck up and I had a stroke. And so after one has a stroke, you know, there's a lot of anxiety there. So I was having panic attacks like every single day. And, you know, I am somebody that believes in medical freedom. I think that, you know, if somebody, you know, wants to go the traditional pharmaceutical route, that's great. But for me, I just didn't necessarily want to go that route. So I was doing research and I happened upon the gut and brain connection. And so I thought, this is so interesting. I wonder if this would help my anxiety in any type of way. And then I happened upon this really small case study by this holistic psychiatrist, Kelly Brogan. So she has some very interesting work. And she did a case study about helping somebody wean off medication by using mindfulness, so just, you know, being more present in your body, nutrition, and then coffee enemas. And then I went down kind of the rabbit hole of coffee enemas and learning about, you know, the impact on the liver, and your liver is your most important detox organ. And I just thought, that's interesting. And then I learned about colonics. And so I thought, okay, so this therapy has been around since, you know, basically like the Egyptian days. It's, you know, just an irrigation of your colon. let me find a place in my area and let me go get one. So, it seemed safe enough, and I got one done, and I was shocked that my panic attacks, they stopped. And so I was like, that's so interesting. So I had a series of colonics, and then I started to get better. And interestingly enough, at the time I was a solo practitioner, and I was renting space out of a psychiatric practice, who I'm going to give a shout out to, American Behavioral Clinics, because they are amazing, actually. They are I would say that they're more integrative, I guess, in their approach for psychiatry. They're not just medication management alone. So anyway, I was seeing a lot of overflow psychiatric patients, but for weight management purposes. And so then, there's always this ceiling that patients can get to with psychiatric medicine. Sometimes it works beautifully, right? And we love that. We love to hear that. But sometimes, they get to this level and they still just don't feel as well. So I was recommending, why don't you guys try this? Of course, follow, the guidance of your psychiatrist and everything like that. But there's other things that we can do to help bring your body into an alignment. So why don't you try getting the colonics? So I referred so many people to get a colonics. And what was interesting is these people started to feel better. And so I did more research about the gut microbiome and the impact on your brain health. And I just thought there has to be something here. So, that's why I added it in 2021 to VIVA Wellness.
Yeah, absolutely. Which brought me on, which is super fun. So in what time would you feel it was appropriate for you to refer one of your clients to a naturopathic doctor?
I honestly think that that's where society and medicine is going, is more of an integrative approach. And I truly think that medication, has its place, but we should be conservative about it. I don't think that it should be the first thing that we go to. I think doing things like, healthy lifestyles, mindfulness, getting out in nature, movement, things like that. Seeing natural supplements, I think that really should be probably your first step. And then if those things don't work, well, then we have medication to fall back on.
Awesome. What other services are we specializing in VIVA?
Yeah, so VIVA is a very interesting practice.
Very unique.
Very unique. Yes, that's a good phrase. But yeah, we started out as a traditional medical weight loss practice, but I truly think that, yes, like I said, medication has its place, right? And I think that for short-term therapy, it can be quite effective for people. But we really want to bring the body into balance and alignment and open up detoxification pathways, because if you're very backed up, so for instance, if your colon is really backed up, then your liver is going to get backed up, and your liver is your main detox organ. And if your liver is not working very well, it is super difficult to lose weight. So, we're looking for services that really help the detoxification process. So colonics are amazing. And then we also have lymphatic drainage therapy that can really just clear the body of accumulated waste, help open things up and get things flowing. We also have IV vitamin infusions, which are really great liver support, and hydration is always quite important. And then we have an infrared sauna. And that's what we have.
Cool. What are the main disorders and issues that you're seeing in your clients lately?
Yeah, so I see a variety of hormone imbalances, PCOS is probably the top one, and then chronic fatigue. So I could go into those more, but we also see weight loss, and then other types of mood disorders and gastrointestinal complaints, like we talked about. But PCOS is probably one that I see the most common, and I like to think of it as insulin resistance of the ovaries. So it's actually more of a metabolic disease than it is really a hormone imbalance, but it also could be caused from, like we were talking about, the gut as well. So a lot of times hormone imbalances can cause gut disorders, but more often do gut disorders cause hormone imbalances. So that's kind of what we were talking about, the liver and weight loss. That's also impacting your hormones. There's also bacterial overgrowth that can cause estrogen dominance, because it releases estrogen that should be excreted into your stool, and then it recirculates it back into the system through beta glucuronidase. So that's one way. But with PCOS, we want to work on healing, metabolic concerns, and the diet is a great place to start, and then getting to the root cause of why that testosterone is so high. A lot of the times it could be the diet. The diet couldn't just be like the only place, but it's definitely the start of it, and then there also could be gastrointestinal complaints along with that. So healing the whole person really does, get to the root cause. Often I see people prescribed spironolactone for their PCOS. Well, that does reduce the testosterone and the symptoms of PCOS. It doesn't get to the root of their hormonal imbalance. And so when we use, peony licorice and other types of herbs to help reduce that testosterone and also help with the diet, we can help naturally assist that person achieving hormonal balance.
Cool.
Yeah.
Love that. Love all of it. How do you feel like hormone and gut health? Do you feel like it's becoming a big component of, like, you're seeing it more often now?
Yeah.
Yeah, quite a bit.
I would say that that's probably the top complaints that I do see is either hormones or gut related.
Yeah. Same. What are each of your goals for clients when collaborating in, like, the Milwaukee wellness sphere? Like, what would you love to see for your clients? Like, what would that look like for them? Like the perfect wellness kind of space.
I would like to see more integrative focus. Like, like I said earlier, like, I think medication has its place and everything, but so many people like just jump to it first. And I think that there's also, somewhat of a, which I think that we're like helping to heal, but like a rivalry almost between like the natural world and like, the medical world. And I hope that we can, build a bridge and like meet in the middle, because it's so important to do that.
Yeah, I agree. I think that for me, I want to provide the most tools possible to my patients. And whenever there's a collaboration, it just makes it that much easier to help someone, especially like with SIBO, that's one example. Sometimes we do need antibiotics to kill off the bad bacteria. And that's where collaboration does actually help the patient, and same with the colonics. And so, just providing people tools to heal themselves is usually my goal.
Cool.
Yeah.
Love it. Do you currently see just people physically in your clinic, or do you do televisits?
We can see anyone with a computer or a phone. So, most across the United States, we can see, I think there might be one person overseas, but for the most part, we see anyone with a laptop or a phone. So if that fits you, then we can see you.
Cool. Love that. How about you, Jennifer?
Yeah. So with my role, it's a little bit different. I can only see people in the state of Wisconsin. However, I can, like Dr. Meister, if you have a computer, like I can see you in a televisit for sure.
Awesome. All right. Did we get any questions in at all? No? Beautiful. Love that. Is there any other stuff that either of you like really wanted to touch on about like your practice that you wish people knew about you, and like how you approach wellness at all?
I think for the most part, as a naturopathic doctor, I really want to help people heal. And sometimes that takes time, and it takes time to get answers, and it takes time to figure out what works best for you. And natural medicine is a little different than conventional medicine, that there are still, botanical medicines that work like drugs. We still have some of that similarity there, but sometimes things take a little bit longer to get the results you want. But in the end, it's a lifestyle change, and it's, permanent change. And so I would say like that's like the one thing that you have to know going into it is you're putting this work into yourself, all this time and effort, money, everything, but in the end it will pay off. You just have to give it some time, and also just learn a little bit more tips and tricks to kind of make it best for yourself.
Yeah, and like echoing off of that, like totally agree, especially with weight loss. Like so often people want a quick fix, and yes, we do offer like different specialty diets and medication and everything, but I'm always very clear with clients, if you have, excess weight to lose, it's going to take time. Like even myself, like I've lost 100 pounds and kept it off for 15 years, but like you have to make this a lifestyle. Like you can't just search for a quick fix. I know like you might mentally want that, but you truly have to take a holistic approach to everything.
Well, so now that you guys have taken time to tune into this, thank you so much. How can people get in contact with you?
Yeah, so they can call Lakeside. They can follow us on Instagram as well at the Lakeside Instagram, which they're probably on right now. And then I also have my personal page too, just some of my videos on there. So you can go to dr.katarina.meister at Instagram.
Cool. And then how about you, Jennifer?
Yes, and then you can find us on Instagram, VIVA_wellness_WI, and then you can also find us on TikTok by searching VIVA_wellness.
Yes. And we also obviously have a really great website as well. So if there's tons of questions you have about whether it's colonic, weight loss, cavitation, you can head to our website as well, which is VIVAWellnessWI.com. And there's tons of info there as well.
We also have, sorry, I just want to add one thing. We also have workshops, and we're in the kitchen space of our clinic right now, so you can see the kitchens over here.
And it's really beautiful.
Yeah,
so
like
pretty.
Honestly, I'm very impressed. They
Yeah,
have like a
it's
full
so pretty.
kitchen here.
Yeah.
I know, it's
Pretty
awesome.
cool.
So
Yeah.
we're having an in-person one soon, so check the website if you want to sign up for the fall workshop.
Cool. All right. Thanks for joining, guys.
Yay!
See you later.